Thanks for coming out today and making time. This is Fritz, and he has generously taken time out of his day to come and talk to us today about heart disease at the end of life, and has a little presentation for us. And there's going to be plenty of time for questions at the end, so if you have any, make sure you write them down so that we can ask him at the end. But
all right, guys. Thank you guys for what you guys do, because frankly, I got a little bit of a remark over there. I think what you guys do is absolutely fantastic. Volunteer for hospice, need the emotional support that they need. It really completely and totally warms my heart, because he had said that out here there's going to be a Ronald McDonald House being built. And we're already starting to see, like, beautiful, like, we're really involved in it downtown, and it's one of my favorite organizations. I absolutely love it. But for a little, like, same premise from what you're doing here, like real emotional support for families, just completely different stage of life. But it's also fantastic. I loved kind of the stories you guys get. So today, what we're going to talk about, kind of in a nutshell, CHF, end of life, disease. You guys are the advocates for kind of the family to be able to disconnect. You guys also are kind of there unplug, and you're also the model for everybody else that you touch. So for the American Heart Association, we're going to talk a lot about like just congestive heart failure, how that all happens, what's behind it. We'll share stories about what exactly we can kind of do about it, what's kind of weird about it, what's not, what's good, what's bad, that kind of thing. When it pertains to kind of end of life, we'll also go through kind of Life Simple 7, which is a concept developed by the American Heart Association about healthy cardiac living, and that having to do with you guys and everyone else that you kind of touch. Okay, not necessarily for those that we support within hospice. However, for everyone else, it's kind of the newly developed thing by the American Heart Association that they'd love to get the word out on. So we're going to go ahead and we'll hit it. So I'm a cardiac anesthesiologist, so American Heart Association and whatnot, very close to my heart when it comes to that kind of stuff. We have a foundation. What we do, we go around the world, we're teaching people how to save lives. So that's what I do in my spare time when I'm not doing cardiac anesthesia. So that's the guy who kind of is the person who keeps you safe and comfortable while you go off to sleep for your heart surgeries. I'm that guy. So hearts and that kind of thing, really, really super important to what we do. So, go ahead. So, basically what we're going to talk about today, there's a little guide at this point. It's called Life Simple 7. It talks about the key 7 things that will make it to where you have better quality of life, less likely to have knee surgery, less likely to have kind of all the untoward effects that can happen to get you to kind of the number 1 and 3 killers, which are kind of heart disease and stroke. Okay. So very basically, the American Heart Association has a big goal. From 2000 to 2010, they decreased the amount of heart disease that's actually in the United States by up to 38%. Was decreased during that time period. Either through initiatives they did, advances in kind of medicine in general. Over the next 10 years, which is 2010 to 20, they would like to reduce 20% mortality morbidity. The key thing that they think that will actually make that happen is kind of adherence to the Life Simple 7. All right, so Clive is the chief medical officer of the AHA. What he says is very basically that if you can kind of master these key 7 components, they're not like a cool 7, these are good 7, there's usually 10, but usually 7 to only worry about. By just these 7 alone, if you can master them by age 50, it pretty much says you can have 40 years beyond that point of cardiovascular-free challenge. So that's usually the time period when people start to develop cardiovascular disease. It develops younger than that, but that's when kind of the effects are most likely seen. If you can master these 7 by then, you can get 40 extra years. So it's pretty actually compelling research that he has on it. All right, so how does this relate to congestive heart failure? Congestive heart failure is at the end point beyond cardiovascular disease. It's once we get kind of past cardiovascular disease level. Okay, what causes it? Coronary artery disease. Infections. Infections can also affect the valves. Once the valves are affected, the heart is basically, when it squeezes, not as much blood is going out from what it was before. So you have to have functional valves and you have to have functional squeeze. Like a lot of things can make the functional squeeze not be as good as what it was before. Anything that damages that muscle, heart attacks, ischemia, any areas where like alcohol can lead it to where it gets very ischemic, it gets large, it gets ballooned out, to where it can pump, but it just doesn't actually push as much fluid anymore. When that happens, you have fluid overload throughout the entire body, okay? Everything from puffy fingers, hands, and notice in the feet, just extra fluid that's on. Worse is when it kind of starts going to the lungs, okay? It's kind of the last place, but that's when you have kind of the really deep cough, and you can tell that there's a lot of fluid that are on the lungs. That's kind of the end stage of congestive heart failure, okay? And that's all just secondary to the heart not being as effective at actually squeezing and being the pump for the system, in a nutshell, okay? All right, so we kind of talked about a little bit what causes it. Now the risk factors for those. So if you dovetail it back again one layer, what actually is behind kind of heart attacks, coronary artery disease, you have life symbol 7. That's actually the things that are at the base of all of these. So hypertension, smoking, prediabetes, eating poorly, all of those kind of fit into the actual root cause of congestive heart failure. So I have a cool app because they have cool apps for everything. And so my Life Check is just another one of the cool apps that the American Heart Association has. You can go in, you enter your data, it spits out recommendations on what it is that you can do. Very actionable and very easy, because a lot of times it can get really, really confusing. You hear a lot of different things, like, oh, well, no, red beans are bad. No, protein is good. Eggs, they're good. No, but you gotta hold the yolk now. You can't do the yolk. Like, skim milk, no, we don't want any milk anymore. Like, all dairy is bad. It's like, it can be a lot of different things. Like, you get a lot of different literature all coming from a different area. It leaves you kind of like a deer in headlights, where you don't really know what the heck you're supposed to actually be doing. By focusing on just 7 things, it makes life a little bit easier when it comes to health in general. So, I like to simplify things if possible. So, first thing, blood pressure. By far and away easily the kind of cornerstone. The biggest challenge, blood pressure, is asymptomatic. You're not going to feel it. I asked my dad 2 months ago, hey, how's everything going with your blood pressure? You checked it recently? Now it's feeling so good, I stopped taking the medication. I haven't checked my blood pressure since. It's good. We're in good shape. I think that one's good. That's not the proper response to blood pressure, okay? Like, it's not something you're going to feel until it's way too late at that point. Headaches, that kind of thing, that means you're almost at the stroke level, okay? You've already caused a lot of atherosclerosis at that point. So by that point, it's not in a good place. The only way you can really know how you're doing here is just you have to know your numbers. You have to get it checked, okay? So this goes for you guys and like pretty much everybody else in your family. Like, if they kind of, don't want to take it for whatever reason, there's plenty of medications, there's plenty of ways that you can actually decrease blood pressure, but it's an easy, modifiable challenge. Getting active. A lot of these are interrelated, as you'll kind of see, because getting active actually helps out with, I think, 5 or 6 of the actual 7. So a lot of them are interconnected, which is nice, because by taking care of one, you take care of multiple, okay? Now, strangely, getting active, that's 150 minutes per week of moderate activity. That's it. That's 30 minutes, 5 days a week. Chop it up however you would like. Only 10% of Americans actually get that. 10%, that's a really, really, really small amount of people actually get that. And women, in case you're wondering, like, does this affect you or is it only guys? Since 1984, there's more women with heart disease than guys. That's since 84. That's a long time now. So that's why, has anybody heard of Go Red for Women by the American Heart Association? That was the whole outreach and awareness of that. There's an amazing amount of heart disease that affects women, and it's sometimes thought of as kind of a male disease. Like, guys get heart disease, they get heart attacks. Women don't have to worry about that because women are usually worried about taking care of everyone else, right? So, take care of yourself too on this, okay? So, checking your cholesterol. Only 25% of cholesterol actually comes from what you eat. So the rest has to do with genetics. So you have to know your numbers here too. You can affect it a little bit through what you eat, a good amount actually, through what you eat. However, if you need to take medications for this, sometimes that's the only way to get it down if you're genetically predisposed to having high cholesterol. Cholesterol can kind of accumulate in areas you don't want it to, breaks off, goes downstream. That's what causes heart attacks. That's what causes kind of the narrowing of the vessels that causes the ischemia. Eating better. I say a lot of these fit together. So, what they're saying here, try to steer clear of sugar-enhanced fluids. Everything from Coke, anything high fructose corn syrup, they can pack an awful lot of carbohydrates and simple fluids, or simple sugars, into just different drinks. It's an easy way to hide a lot of very bad things for us. Okay, the more processed the food is, usually by and large, the worse it is for us. So anything that's fresh, raw, vegetables, fruit, whole grains, all that, still considered good. Fish and their omega-3s also considered very awesome. I'm sure you guys will have questions about this later, so I won't spend a ton of time on it right now. Losing weight. So this goes back to the BMI. BMI is a calculation of your height and your weight. Okay, they use the metric system, which we commonly don't here in the United States. They do it for all of their good studies, but again, it makes it completely and totally arbitrary on what 25 is. Do you know what your kilograms over meter squared is? Unlikely. So luckily, Google can figure it out real quickly for you by just typing it in. But it's relatively kind of a pain for us to kind of know exactly where we are on that, okay? But with weight reduction comes a lot of the other things synergistically all working together. Again, blood pressure. How do you actually decrease weight? By eating well and staying active. We just mentioned 3 of the other 7, so that, like pre-diabetes is one of the other ones that also goes down with weight control. So all these are relatively interconnected, which is great. Okay. So smoking. This is kind of the one outlier on the whole thing. A very modifiable risk factor. You start to heal from smoking as soon as you stop smoking. So literally as soon as it stopped, the body starts repairing itself. So I get a lot of patients, because I do lung and heart surgery, they're like, listen, I've smoked for 20 years. It's not going to make any difference at this point. My lungs won't repair themselves. You can have a lot of reasons to not smoke or to continue smoking, but that shouldn't be one of them. Because your lungs will repair themselves. Okay? Short of like very end-stage emphysema, they can repair themselves relatively well. They have all the building blocks they can repair. It's just one of those things you need to stop. And they have multiple ways that you can do it now. They have medications, they have counseling, they have support groups, they have all kinds of stuff. So, if you know anyone who actually wants to quit smoking and is still smoking, there's plenty of help for them. So, please don't hesitate to get them over for that. So, blood sugar. This is the prediabetes I was telling you about. Like, as you get older, usually, you've heard of kind of type 2 diabetes. What usually happens is your body becomes more resistant to the insulin that's actually released by the pancreas. Okay? In contrast to type 1 diabetes. Type 1 diabetes has to do when your pancreas isn't giving out any insulin. At that point, that's a little different in the way of treatment. What usually and most likely happens is what we call syndrome X. You start to get a little overweight. You start to get high blood pressure. You're not being active, and you're eating too much. I've already covered 4 over here. What happens? Your pancreas is throwing out insulin, but it can't keep up. Therefore, there's extra sugar around. Sugar coats your red blood cells. Now it becomes very sticky. It sticks in a lot of places you don't want, like in arteries, veins, any of the small vasculature. When it sticks in there, that's when you have ischemia, because as soon as it kind of sticks and blood can't get past it, all of a sudden, whatever that was feeding, that is no longer getting fed, any nutrient. Okay, so that's what we talk about with congestive heart failure, when the heart just can't squeeze as much, it doesn't have as much good muscle around it that can actually support itself. So, in a nutshell, the reason we have Life Simple 7 decreases the likelihood of illness, heart disease, increases your quality of life, all that good stuff, all in one nice little plan. So, Basically, it's a basic success plan. You can go online. They have it there. Please share it with whomever you guys kind of touch, hang out with, and stuff like that. It's a really, 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 really great tool to kind of help. And that's it for the scheduled programming. Now I have time for questions for you guys. Throw out any questions you have about congestive heart failure, like what you're seeing in your kind of daily life. Anything, questions about the presentations, any of it.
You say go online. Is this foundation network?
Oh, that's the foundation that I have. It's My Life Check. So if you just Google My Life Check.
Does that have to be on a smartphone or is that on the computer as well?
Oh, computers. We have it optimized for everything. Yeah. No, completely online. Like go ahead online, any computer, tablet, handheld, all that stuff. They have it optimized for everybody there. Yeah. I think it's .com, but it's hard to say. They'll probably redirect you because I bet they bought both domains. So guys, questions? Anything about cardiac health, congestive heart failure, weird things you're seeing with your patients, you're wondering why the heck that is, but you always just wanted to ask a physician about it? I can't guarantee I can answer it, but I'll try.
I hear a lot of pros and cons about statins. Could you elaborate on that a little?
So the latest research that I've heard on statins, they have kind of a mixed bag. Luckily, I can look at it luckily or unluckily, we have a lot of people that take statins now. Okay, so statins are lipid-lowering agents, okay? Drugs you might have heard of in that category include Lipitor, Zocor, lovastatin, Mevacor, all of those are kind of in that, Crestor, all of them are in that big group, okay? There's a lot of people taking them. I think Lipitor is actually the highest prescribed drug outside of Vicodin, if I remember right. I was once a pharmacist, so like I think actually it's definitely the highest grossing on cash. That before it went generic for sure. So there's a lot. The thing about that is there's a lot of data around it now, and they're able to gather it because when they test the drugs, they have a small sample size relatively of people, even if it's thousands. Now with literally hundreds of thousands of people taking it, they have a lot more data. So teasing that out can be very, very tricky. So what they're saying about statins is that they make a lot of associations. So like, I've heard that it's helpful for everything from prevention of Alzheimer's, heart attacks, colon cancer. What they're finding overall is that it decreases inflammation. So they don't know why or how. It's like, oh, it's the practice of medicine. They don't really know why it happens. They don't have a mechanism, really. That's well thought out. Don't worry. They have thoughts. I'm not sure if that's right. But what it does is it decreases inflammation. When you decrease inflammation in the body, life gets easier. Life gets a little bit better. Okay? So inflammation pretty much leads to all of kind of the autoimmune disorders in general. So any decrease of that can be helpful. So it's helpful for a lot of different things. You can't affect one system without affecting other ones. Okay? So it is very good. We know that it is very good for decreasing LDL, which is low density lipoprotein, which is for cholesterol. So it's good at that one. So that's awesome. The other things that it's doing that we're not 100% sure whether it's great, muscle cramping, fatigue, Charlie horses, that kind of stuff. Those are all side effects, long-term effects. They're still kind of feathering it out. Which one in particular did you hear about? Did you hear good, bad?
Well, I've heard both. That's,
Yeah.
You know, and so many people that are on them are on them long term.
Yes,
That
correct.
I'm wondering, you know, about the cumulative, you know, I mean, muscle cramping and things like that are you don't die of a muscle
Yeah,
cramp.
short term.
So that's not as big a concern, but some of the cognitive effects, I guess that would be a big one.
Yeah, completely. For cognitive, it seems like they have kind of the link with Alzheimer's and it. Whether that's proven or not proven, 100% on that. If anything, they're thinking it might improve cognitive effect overall. But again, it's one of those things, in order to tell that, you you have to have a good amount of people on it for a long time to know how it does. You know what I'm saying? Because like, there's none of the drugs are perfect. That's a lot of the challenge with all of them. Like, for me, like I think the body constantly tries to heal itself, and the medications are only there just to kind of give it a nudge in that direction. Like just to like, but whenever you take it for one reason, you get the other effects of it as well. Because what you're doing is the body's homeostatic position. If you're moving it in one direction, you move everything. So like everything else kind of gets a little out of whack as well. So that's why we take a lot of medications to actually counteract the side effects of some of the other medications that we actually take. So when I was a pharmacist, sometimes I'd see people with medication therapies, and I know that you see with a lot of patients like 15, 16, 17 medications. Come on, really, seriously. Don't tell me that at least 4 to 6 of those aren't just medications to take care of the side effects from the other medications. You know, so like that's tough, but that's why it's kind of a practice and a balance. I would say, for me especially, like when I see kind of the overall data of statins, I'm still very pro-statin. Like my father, still on a statin. He needs it for his LDLs. LDL's high, and he can't control it with diet alone. Could I be wrong? Probably, maybe. I've been wrong before. But at the same time, I'm comfortable enough, and I like my dad. I should say that as well. So like, then I would try at least, you know, to kind of give him the best care that we could. So I think net effect still good with the statins. But luckily that one's is kind of under a microscope, so we'll know a lot more about it as time goes on. Okay.
Do they tell patients to be on some supplementation, so to counteract those instead of the medication? So like 12, vitamin D, you know?
Usually, most physicians, and I can say this because we didn't, they're not properly trained in the way of nutrition and nutritional supplements. They get a lot more training in the way of medication and how to fix things through medication management, more so than through nutritional or like vitamin supplementation. I think, me personally, I think that's a little bit of a deficiency that can be kind of worked out a little bit more, because I think there's a lot of things that can be helped out through diet change and through supplementation, where we wouldn't need a prescription medication for it. But it's a whole lot easier to prescribe that. It's so, like when you have somebody looking at you in the office, like I feel for them, because when they look at you in the office, they're like, I just want a prescription so I can give it to the pharmacist, they can do it and I can fix me. Don't tell me that I'm not supposed to eat my, like Little Debbie's and all this other stuff. Like, don't tell me that. Like, I know I'm not supposed to eat that, but I don't care, okay? Like, just give me a little something to like get me through. So, it's a little easier. It's certainly the path of least resistance to kind of go kind of easier.
How does the baby aspirin therapy come into?
That one's been new in the news too. So, like with baby aspirin as well, anti-inflammatory is what they're saying with it. Like, because again, you've had people, and a lot of people take baby aspirin for a long time. Okay, so theoretically, same type thing. What it does is it modifies platelets to where it makes them a whole lot less sticky. Okay, which can be good and bad. If you have a stroke and you're bleeding in your head, you're going to wish you didn't take aspirin. But for almost a lot of other things, almost all other things, you're going to be happy that you did. So everything's kind of a balance on which one you have a higher incidence of risk for. Everything's a balance there. Baby aspirin's still thought to be very good. They came up with new research, I think it was like 3-4 months ago, or weeks ago, that had to do with, is a baby aspirin actually good for you or whatever? The mountain of research is all over here. Like, to get some attention, they can, like, produce that.
So would you take that along with the statins and
For me, no. Like, that's basically standard of care still, to do both. So for cardiac care, like kind of post myocardial infarctions, like say you have a heart attack, that kind of thing, beta blocker, statin, aspirin. like that's basically your ABCs. You know, like aspirin, beta blocker, cholesterol medication. That's an ABC. Like that's they give you some nitroglycerin in the event that you know, like you need to have that for an emergency kind of case. It's like those are very standard. Like I said, practice, so they can always change, but there's a good amount of data behind those that shows that they are helpful long term.
About the regular aspirin versus baby aspirin. Is it just the bleeding possibility with the aspirin then?
Yeah.
How regular is that?
Not great. It's not a huge amount, and even the way that they do their dosing and everything anyway actually goes back to the ancient Greeks. Like, why 81 milligrams? That's a grain. A grain is a measurement they used in ancient Greek. Who uses grains anymore? Like, nobody uses that. It's like, why 325? It's 5 grains, 81 times 5. That's silly. It's so silly. But in any event, like, that's where all the data started. And now here's where we are. You know what I mean? So like, it's very old research kind of moved and carried forward. But like, if you're taking kind of a baby aspirin versus, you know, like a full strength, regular strength aspirin, they'll say that your bleeding risk is slightly higher. Okay. What they're saying is, if you just took the baby aspirin, which is less, you'll have less chance of bleeding, and you'll still have like the protection effects of the platelets not being able to be as functional as before. So that's better, but not a huge, not a monstrous difference. Does that make sense? Most part?
When you talk about inflammation, what would be the difference in an aspirin and an ibuprofen as far as controlling inflammation?
That's a good question. I don't know. That's a short answer. They don't affect the platelets the same way, like an ibuprofen and an aspirin. I'm not really sure why. They may actually know that information, but I don't.
One other quick question, back
Please.
to the supplements,
Mhm.
off the record. If you had to say the one supplement that you think we should all be taking, what would you, or maybe 3, whatever. You're in top.
Yeah, I'll give you 1, 2, 3. A multivitamin is the number 1, just in the off chance that you aren't getting it in your diet. Number 2, omega-3 fatty acids. In the event that you're not eating enough, say like avocados in your diet, you don't have enough fish in your diet, you don't get enough plant-based like diet, omega-3s have been shown to be very, very good. So if you're taking anything over the counter, those 2, I would say, are easily the top 2 that I would recommend. And then the others are just kind of person specific.
Right.
You know what I mean? If you have the intestinal, you know, like absorb things terribly well, and, you know, like you might look into things like B12, things like a B complex. Like there's other things that can be more helpful depending on a person's circumstances. But those 2, I would give to anybody.
With the life check and focusing on these large areas, the condition of my heart, my blood pressure, and things like that, what role, if any, does stress play? I can't really monitor it. It can change with a phone call. Everybody has it. If you're driving or doing anything, does that play an absolute physical role in all of this?
Yes.
It does. Okay.
Huge. Please, like, can you tell in your life, like when, like health-wise, how your health is when you're under much more stress? Even if you keep your diet the same, even if you keep your exercise level the same, like the challenge medically with it is really tough to measure. And there's a lot of interperson variability with it. You can't say, all right, we're going to put people under this kind of stress, and then we'll see what happens. Each person manages stress differently too. So a lot of that kind of comes back with how do you manage the stress that you have, like everything from mindfulness, like meditation, yoga, that kind of stuff, like just how you actually de-stress. It's really hard for them to monetize that in a doctor's office. So it's not a focus. You know what I mean? Like on a billing sheet, I can't find that box to check. So we're like, not in a horrible way, but if you wonder kind of like medicine in general, like how things change and how things kind of move over time, people do things based on incentive. If there's no place where we can do anything for it, like, just don't spend a ton of time on it. But yes, stress, huge effect, huge. Like, so there's tons of different ways. Like people who have stress management kind of challenges, you know, like there's a good amount of areas, bless you, for it. Like kind of how to do that. There's a good amount of data on that as well. Wonderful books and whatnot like this too. About like what actually happens. It's what actually like it's a way to like de-stress. But yes, that's something that's impossible. Well, not impossible, like very hard to actually measure. You know, like so we just don't know how to actually. It's all psychological. Like that's a really tough one. And psychology
But it
in
does
general.
have an actual physical.
Yes. 100%. Your inflammatory markers will go up. Like your insulin resistance will actually go up even throughout a day. Anybody wonder why you get hungry at night? Like why you eat at night when you're hungry, and you can keep eating because it doesn't really matter. You're not getting your hunger taken care of.